12:01. I'm fast asleep. The phone rings, and it is a lady from Oxford going, "It's your time to transplant, and you need to come in now." And I remember sitting up on the bed and just being scared beyond anything. And you've got to remember that I didn't know if I was coming back again. I was number 11. 5 of the first 10 died.
Michael's story was one of the 25 stories that we shared in the Humans of Healthcare exhibition in London over May 2016. We hosted an exhibition in a gallery with 25 black and white photographs. There were audio recordings on the wall and some story extracts as well. And we invited people into the gallery space to listen, to read, to reflect, and to share their own experience. We didn't set out to talk about death and dying, but death and dying came up as a theme over and over again, whether it was the death of yourself, the death of a family member, a friend, a work colleague, or, if you were a health and social care professional, the death of a patient or a service user that you were caring for. So these are some of the experiences that we wanted to share with you.
If you block the humanity out of the practice of medicine, it's quite a lot easier.
In what way?
There's something called the collusion of anonymity, where patients pretend you're not a doctor and the doctor pretends the patient isn't a real human being. And if you can keep that humanity of the other person at a distance and make it just a kind of technical transaction, emotionally it's much easier for the doctor. And there's an element of that you have to do in order to keep doing the job and not become emotionally exhausted. But actually, if you do it too much, you miss the whole point.
That reflection came from Mark, who has been a doctor for 25 years. And it's a reflection we'd heard from many clinicians who came into the exhibition around how do you keep your humanity? How do you bring empathy to a quite difficult relationship and protect yourself and your energy levels as well as honouring the relationship that you have with the patient?
I was needing to tell her that she was dying. Well, I wasn't actually. She knew she was dying. We were going through the motions where I came to the realisation that she realised she was dying, and I was in my own clumsy way trying to get there. And I was quite a young GP at that time, and she helped me do that.
How did she help you do that?
She was a teacher, and she taught. She couldn't resist teaching. So I was starting off, exploring her ideas and what the books teach you to do around breaking bad news. And she was saying, "You're doing this really well." When I finished, she said to me that she was pleased that I was the one who had told her that. And she was grateful that I'd told her, and it was a very special gift.
I suppose end-of-life care is one of the most important things in the end, because I do believe strongly that what we're left with about the people we love when they've gone is so important. How did they die? What was the care? How was the funeral? All those things can cloud a lifetime of memories, actually, if they don't go well.